Hi, my name is Sheryl Cohen. I'm an educational psychologist and a mother of four, and I hope to use this time to share with you some skills, insights, and practical tips on working with parents. These skills and insights are based upon the 27 years of therapeutic work I have done in working with parents. So we'll divide the discussion into three separate parts. The first I would like to present is based on the assumptions of working with parents. What do we assume when we enter into the therapy room and work with parents? Whether it's one parent or a couple, these are the assumptions that we need to take. The second part we will look at is the theoretical underpinnings of the work in working with parents. And the third part will be some practical applications on working with parents and working with some troubled spots, difficult parents, or difficult relationship issues in the therapeutic work. So going to section number 1, what are the assumptions in working with parents? So the first assumption is nobody wakes up and says, today I want to mess up the kids. This is a very important assumption in working with parents. I believe that every parent wakes up in the morning and wants to do what's in the best interests of their child. But something does go wrong. And this is when parents present their troubles to you in your office. And our job is to work out, where does this difficulty lie? Is it maturational? Does it lie with the child? Does it lie with the parent? Does it lie in the relationship between? Is it maturational? Is it possibly developmental? Is it environmental? Is it social? Is it emotional? Is it physiological? And maybe even, is it neurological? And the insights or the exploration of all those different areas will guide you as a therapist in terms of your intervention. So the important part of starting the session in working with parents is to get a good idea about the presenting problem. What brings you here today? What worries you? And then you can take that information and hang it on the hooks of these different questions to assess where your work will, the direction of what your work will take or where you will go in these situations. So I think that we do want to join with our couples, with parents that you work with, so that they trust that you are on their team. That brings me to the next assumption, and that is to take a very non-judgmental approach. So while we do need to use our thinking brain or our analytical insights in order to understand what might be going on, I think we need to understand that parents do try hard to do the best that they can with the tools that they've got. And if we just believe in that, then we don't need to say anything, but parents will feel that we are on their team, that we're joining with them, that we support them in order to support their child and to hopefully encourage change that will ensue from your therapy sessions with them. There's the third assumption is the common dictum is based upon the common dictum that says there's no such thing as problem children, only problem parents. And I don't believe that. As I said, I don't think parents wake up at all in the morning and say, I want to mess up the children. In fact, I think that what happens is something goes wrong in the relationship between the parent and child. So it's not like the child is doing something deliberately to make the parent's life a nightmare. And it's not like the parents are doing anything deliberately to make the child's life hard. I think something goes wrong. And that doesn't mean that children can't make it worse or parents' behavior can't exacerbate the difficulties. But sometimes it's something that goes pear-shaped in the space between. And our job is to try and evaluate and identify and work with what is going on in the relationship between parent and child in order to facilitate growth, change, and development. I've often been asked, what's the difference between play therapy and parent counselling, and what's the relationship between the two? So I believe, and my experience shows, that if a child is in play therapy and the parents are uninvolved in the process, It's a bit like going to a dietitian and trying to lose weight and being on diet when you're in her or his office. It doesn't work. In order to lose weight, one goes to the dietitian, gets the direction, and needs to carry that out into the world, obviously. And the same for me goes with play therapy, the relationship between play therapy and parent counselling. So it's absolutely imperative that parents are part of the process. So while parents might make it worse at some points, they also have the power to make things a lot better. And that's why I truly believe in parent as being part of the solution more than I believe that parents are part of the problem. And so I think it's a great assumption to harness their capacity, their involvement, and often willingness to participate in the therapeutic process, so that when you're working with a child in play therapy, working with the parents will assist in creating overall change, growth, and development. Okay, moving on to the fourth assumption. There are no perfect parents and there are no perfect children. And this isn't new. In fact, I think we kind of know this intellectually, but also to digest it emotionally as well. I'd like to make this point and take it a level deeper. And that is that children have obviously different ages and stages of development. And sometimes those ages and phases bring out the best in parents and sometimes the worst in parents. I have seen parents who will say, I am so good with the baby phase. It's adorable. I love them. They are warm and cuddly and just the best. But I cannot deal with teens or an older child that pushes the boundaries and wants things as they want them, when they want them, how they want them. And then there are other parents in my office that have said, don't give me the babies. I don't know what they need. I don't know what they want. I'm much better once they can talk and they can tell me. So I think that we have to be cognizant of the fact that the parents that present to you in your office are not necessarily in a phase and stage of development that they themselves might find difficult. But it doesn't mean that they'll always stay there, and that we are helping them in the arrest in this developmental phase, both in terms of their own intrapsychic world and their child's, but that things could change over time. Then there's also the important point about a fit between parent and child. Sometimes there's an easy fit between one particular child and one particular parent, and sometimes a more difficult fit. Now, when I've asked parents in my office, do you have a favorite child? They don't like the question. In fact, if you think about it right now, you might feel uncomfortable with that question as well. Do you have a favorite child? Interestingly, most parents in my office say no, they don't have a favorite child. When I see the children in therapy and I say, does mommy or daddy have a favorite child? Most often they say yes, they do. So that's an interesting discrepancy, because parents don't want to have a favorite child, but children often do experience a favorite child in the family. When I ask those same parents to think about their own parents, did your parents have a favorite child? They most often say yes. However, I think that the way in which I've understood it over many different therapy sessions is that I think parents do have favorite children, but for different things. And that's the qualifying question. It's not an all or nothing kind of thinking. In other words, there might be a favorite child to assist with, for example, giving a more responsible child in the family that would assist a parent in getting a message across maybe to somebody because they just happen to be a little more competent in that department. There might be a favorite child for helping around the kitchen. There might be a favorite child for helping clean up. There might be a favorite child for having fun or whatever. So I think it depends on, it's contextual. So I think that that's something that I think adds to the fit between parent and child, is that it often, and favorite and non-favorite children, something that can be contextualized. And the next point about that is that I think the idea about favoritism or preferences in the fit between parent and child changes over the developmental lifespan. I've asked friends of mine, is the child that you relied upon or you favored a little more in this particular area when they were little, the one that you favor now? And that changes as well. So I learned this from my older patients as well, where they might have one particular child that they really didn't, found. One example is found quite ditzy when she was little, quite an ADHD child. But in her older years, this child is making unbelievable efforts to take care of her, to assist her, and to help her. So I think that those relationships are changing and developing. And our job as therapists in this domain is to help create the best fit for our children and our parents. And this brings me to the next point. The next assumption is that identity formation is always in the process of developing. When I was at varsity, we learned that identity formation happens in adolescence, that teenagers are in the process of developing a sense of self. However, that is no longer, I don't believe that that's completely valid. We are always in the process of developing our identities. When you become a parent, you change your role, you change your identity. When your parents age and you begin to need to look after them, you change your role, you change your identity. So just like our children are growing and developing and changing their identities and their roles socially and in the family, so we too need to access and allow ourselves to redefine our identities all along. And that brings me to the next point, which I feel is something I've learned from my own personal experience, and I call it the X spot. And that is, in your therapy, you will come to a point where you realize that the very thing that the parent needs to work on is being brought out by the very thing that the child doesn't do. Let's take an example. Let's say mom is fastidious. She's very organized. She's predictable. She's consistent. Life is familiar. She's competent and capable in the world. She has a little boy, Mark, and he is completely all over the place. Disorganized, a big mess, unpredictable, doesn't join the dots of packing his cricket bag and taking it to school, leaves it in the car, shoes behind. This is what drives mom crazy. She gets cross, frustrated, irritated. She cannot understand how Mark can't just connect the dots and be organized, consistent, and predictable. After all, she's modeling this behavior for him at home. Now, the thing is that the very thing that she has to work on is called the X spot. I call the X spot because Mark gives her the opportunity to chill, to hang back, to be able to prioritize what she needs to teach Mark, but also not to get into a power struggle with him for every event. Otherwise, she's going to ruin the relationship with him. So she has to work on, in herself, the very things that Mark brings up through his emotional and behavioral expression. And this happens in almost all my parent counseling therapies. And I always think that either God's got a sense of humor or it's supposed to be like this, but I'm not sure why. But this is where children give parents the opportunity to grow. I sometimes actually verbalize this in a session where I'll say, if your spouse doesn't give you the opportunity to grow up, your children definitely will. So you'll get this. This is called the X spot. And when you get the X spot, you know you are doing a great job as a therapist. Keep going. The next point I'd like to say in terms of assumptions is that parents sometimes feel that the way they were parented is the way they would like to parent their children. And some parents feel like the way they were parented is definitely not the way they want to parent their children. And I want to add that both these models are not a good blueprint for parenting effectively. Parents, again, going back to that fit, need to parent according to the good fit that they find with this particular child. Harville Hendricks and Helen Hunt wrote a lovely book called Giving the Love That Heals, and they show, interestingly, that when parents use the opposite defense mechanism to parent their children, in terms of how they were parented, they end up injuring the child in exactly the same way, but using opposite defense. Let me give an example. So let's say mom's parents were very harsh. She's decided she's definitely not going to be harsh with her child, and so she is very relaxed. She has laissez-faire style of parenting. She has no boundaries. Interestingly, the child feels in this situation like mom doesn't care about me that much because there are no boundaries. Just like mom felt that her parents didn't care about her because their rules were so harsh. So here is the opposite way or style, which ends up with the same injury for the child. So our job as parents is to stick to a model that Bruno Bettelheim calls an integrated approach. So this would be where he says where you have the parent and the child in the picture. If we are only parent-centered, the child's going to feel resentful and his or her needs will not be met. If we are only child-centered, the parent will feel like my needs are not being met. So we need to have both, keep both in mind. So this would also correlate with another school of thought called dialectical behavior therapy, where the dialectic is having two opposites almost in mind and keeping them both in mind in your therapeutic approach to working with parents. The second last assumption I would like to share with you is, it's actually a tip or a skill, is to take a minute after the session and just use your own projective identification, what Beyond calls projective identification, of what must it feel like to live in this family. In other words, the idea of projective identification is that your client will project onto you a particular experience and you'll use your feelings inside of you to work out what that might feel like. And that gives you a lot of emotional material with which to work in the session. So the questions I have and I ask myself when I'm finished working with a client, a parent couple in therapy is, what must it be like to live in this family? How would I experience mom? How would I experience dad? How would I experience my siblings? So using that emotional material for you will give you an idea about some of the goals of the therapy that you can set. The last assumption that I'd like to add is the one that Beyond calls reverie. In other words, building reverie is about being able to take a stance and receive what parents are giving you in the session. So it's emptying out your mind, coming into the session like a blank slate, kind of, and giving them the opportunity to really offload all the stuff. So it's a bit like you standing there like a tennis player with a racket and waiting for the ball to be served. So you have complete eye contact, even if it's on Zoom, complete interest and willingness to receive what they're giving you, and then to hold that information. That's called the beta elements, what Beyond calls the beta elements of the information they give you, and you'll mull over it over the course of the parent counseling sessions. You'll unpack it, you'll work it out in your mind, you'll process it, and you'll give it back to them in a digestible form, which is what Beyond calls the alpha elements. So that's going to be the stance and the assumption that you take in this therapy called parent counseling. Okay, so we've come to the end of the assumptions and we will move on to the next section, which is a developmental model of how to run a parent counseling session. Let's look at the developmental perspective and the theory that underpins this model for parent counseling. And I often use this in the parent counseling sessions because it helps parents to understand things better. So let's look at how the family presents. So we could say that this is the parent and this is your child. Now, parents don't just represent themselves. They also, we could say, this is part of the outside world, the world of siblings, the peer group, the world in which of expectations, where parents want their children to obviously grow up to be socialized and civilized human beings. And this is the child or the child's internal world. Now, when the baby is little, these circles totally overlap. You will lend your baby your ego and think and feel for the baby. Parents will have to decide, is the baby hungry, tired, cold, sick, wet? How does the baby feel and what does he need in order to survive? And we all know that babies would not be able to survive even if they were left in a room full of food, because they wouldn't be able to get to it and they certainly wouldn't be able to digest it. So babies are in a state of complete helplessness, or we could say in a symbiotic state with their parents, or a parent rather, right at the very beginning infant stages of development, and we call that a state of primary narcissism. Now, that's not the same as a narcissistic personality disorder or secondary narcissism. We're not talking about that. We're talking about a healthy narcissism where babies do need to see the world from the inside out, and they are narcissistic because it's the only way that they can get their needs met. So when you come with a bottle or a breast full of milk, the baby magically thinks that he made you appear or made it appear. He doesn't realize that he depends upon you to go get the milk, to work, to pay for it, or to eat properly so that you can kind of produce enough milk to feed him. So this is the state of primary narcissism, which all babies are born onto that pedestal. And it reminds me of a very interesting story of one of my own children when they were babies, and my daughter was sitting on my lap and we were at the table. It was a Sunday lunch and she was playing with the spoon and she was kind of banging it on the table, and somebody told a joke and everybody laughed, and she looked around very cutely and thought that her banging of the spoon is what caused everybody to laugh. So it was such a real example for me as a mother and as a therapist of noticing how babies are so self-centered, egocentric, or narcissistic in their early phases of development. Now, usually that lasts about 18 months. Then the circles begin to separate, never completely, because there's always going to be an area of overlap where you're always going to be the parent and your child's always going to be your child, whether they're 18 months, 18 years, or 180 years old. And we could say that that process of separating is what Erickson calls the process of individuation. It's the process of it becoming more autonomous and independent. Now, I would prefer the word interdependent because we don't want a relationship that looks like that, where children totally have no relationship with their parents or it's too separate. We need an interdependent relationship. Now, this space in between is called the transitional space because it's the transition between the child's inside world and the outside world. And it's often filled with transitional objects like a dummy, blankie, botty, and it acts like children's Prozac. We've seen it. When a child of 4 or 5 falls off the jungle gym, they often cry, need comfort, of course, but also want the dummy, the blankie, the botty, whatever it is, because it helps them to be able to take the object and internalize something comforting from the outside world. Something horrible happened in the outside world. They can retreat into their inside world with a transitional object that provides a tremendous amount of comfort. So this is transitional objects, by the way, are very healthy objects that children do need in the process of growth and development. We know that the orthodontists don't like the thumb, the dummy, etc., because they complain that children will need to have braces. I'm still waiting to see the child that doesn't need braces. So I'm not sure that I buy into that, but I do feel like these objects help the child to make the transition of whatever goes on in the outside world to internalize it into the inside world. So we see it as the child's first internalized owned objects, and it helps them to develop what's called introjects, which is a mommy and daddy inside him or herself, and they're very helpful. It's the same as, for example, if you went shopping because you had a birthday of a mom or a dad or a grandmother, you might be able to buy something for them based upon how you experience them inside of you. So you have built that introject. And that's what children are building all the time. An introject, an internalized, owned idea about mommy or daddy or other significant caregivers in their world. And it's a healthy way of developing that. Okay, so what happens in parent counseling often is that the child's boundary gets pushed. In other words, let's take an example of Sarah. She wants things as she wants them, when she wants them, how she wants them. So what does she do? She pushes the boundaries until she takes over the whole space in her parents' circle. And of course, that causes parents a lot of distress. And what mom and dad will do is they'll say, enough crying, enough shouting, enough screaming, and they'll take their boundary and they'll push it into this space over here. And then what happens? The diagram begins to look like that. So we can see that creates a regression. And that's the part that I think is the goal of parent counseling, is how do we help parents stay in this transitional space? How do you parent effectively when you can consider your needs as a parent or as a therapist? You're supporting the parent's needs to exist and at the same time supporting the child's need for expression. So this doesn't mean giving in to the child. It doesn't mean giving in to the parent. It means, like Bruno Bettelheim spoke about, keeping both in mind, but at the same time setting good boundaries between the two so that the relationship is not compromised, but rather it's used as a springboard for other relationships of growth and development. And I'm going to share with you how to do that. I'd like to share with you now the third section of our presentation and discussion, and that is how do we deal with these boundary issues and this developmental process of keeping the child in mind and the parents' needs in mind and being able to assist the parents in parenting effectively. So the point is that it's not just that the parents have their needs. It's not just that, the parents want to, go to bed and watch series. It's not that. Parents really do represent the needs of the outside world. Brush your teeth, do your homework, wash your face, say please, say thank you. It's just the normal developmental or social and civilized norms of society that parents bring to the situation. And of course, children also, they're not waking up and saying, I want to make my parents' life a nightmare now. It's just their developmental needs of having things as they want them, when they want them, how they want them. But as we said, children need to be tippled off that narcissistic pedestal. They're born onto it and they need to be tippled off because life doesn't work like that. They can't have things as they want them, when they want them, how they want them. And I believe that if children can learn and practice being tippled off the narcissistic pedestal in the loving, close and supportive relationships that you have with them, it'll be much easier than getting tippled at school by the teacher or the social peer group where they don't have that support. So I think that from 18 months up to that stage, it's often called the honeymoon phase, where you put suntan cream on your baby and the baby goes along with it. But afterwards, they don't want that because they're developing a separate sense of self of I am me and you are you, and I don't want suntan cream or a hat or to take medicine or whatever it is. And that's when we do see the child's autonomy beginning to develop, and we have to be able to facilitate that, but at the same time create some boundaries so that the needs of the outside world are important and considered and taken into consideration. So now I'd like to share with you, how do we do that? So let's take an example. Let's take an example of Kayla. Kayla is 5. She loves artistic and creative projects at home. And she wants to paint and she wants to sprinkle glitter all over the page, but she also wants to sprinkle glitter all over the house. Okay, so this is just a practical, small example. So now, mom doesn't want Kayla to sprinkle glitter all over the house, and Kayla has an absolute meltdown. It's also well after 5, it's been a long day, and everybody's a bit tired, but at the same time, glitter is not going to be sprinkled all over the house because that's a lot of hard work to clean it. So what happens is Kayla has a meltdown. She's kicking, screaming, shouting, crying, fighting with mommy. So what does mommy do? And this is where I'd like you to use what I call the art of parenting. So it's an acronym and it stands for, let's just make some space here. A is acknowledging the feeling. R is reflecting the wish. And T is taking action. So mom, as a parent, will need to step out of her world and step into her child's world and acknowledge her feeling. Now, every psychological theory and self-help book on exclusive shelves will say the same thing. And it's quite nice when theories correlate, because then you know you're on the right track. Parents do need to take a moment to step into the child's world. And when I explain it to parents, I always say, go over a little bridge. This is, I learned from imago therapy. Leave your world behind and step into the child's world and validate their feelings. Give it a name and validate it. Now, this mustn't sound like, Kayla, I can see you very upset, but that's not validating a child's feelings. That's what it sounds more like is, Kayla, you are furious. You are very cross with mommy. You even prepared to spit and use mean words to show me how very cross you are. So the trick here is not that you're agreeing with Kayla, it's that you are stepping into her world and understanding Kayla. And I've seen how powerful this strategy is. In many sessions, parents come to see me, and I'm sure you too, where they say, we've tried everything. We've tried star charts, we've tried choices, we've tried consequences, we've tried taking things away, we've tried punishments, we've tried everything, nothing works. And often my experience is that those things do work, provided they proceeded by acknowledging the child's feelings. If children don't feel heard and understood, they turn up the volume and then you get it in stereo. So it gives parents an opportunity to actually become more successful, but acknowledging feelings also gives children the opportunity to be heard and to be understood. But we don't stop there. The next part is to reflect their wish. And this might sound something like, Kaylee, you really wish you could sprinkle glitter and make this whole room and house shiny, like a fairy castle. It would be beautiful. Imagine how pretty and lovely it will be. And I know how much you love glitter, and I know how much you love sprinkles. This would be your dream. I get it. So you acknowledge the wish. So that's also a very powerful tool because it gives the child in fantasy what they can't have in reality. It would be like me saying to you as an adult, what do you wish what would you do? Imagine COVID doesn't exist. Imagine there were no masks, no COVID. What would you do? What do you wish? It kind of gives you a feeling of comfort, a feeling of gain in this experience of loss. So this is something that's very powerful for children. And remember, children they use a lot of imagination to color their worlds. So that's why this is a pen to you and me, but for a child, it's now a cell phone or something else. So if we give them in fantasy what we can't give them in reality, it often just calms them down a bit and gives them a sense of gain in this experience of loss. And then, of course, you step out of their world, back into your world, and you take action. And that action might sound like, Kayla, my angel, glitter is an outside activity. There's no glitter inside. It's dark and cold. Let me know where I can put it. You can choose where you'd like mommy to put it to make sure that we can have a chance to play with it outside tomorrow or next Saturday. You decide. So it might be a choice that you give a child. So the action could be a choice. It could be a logical consequence. If you can't use the glitter for outside play, then I'll keep it and we'll try again tomorrow. It might be It could be a variety of different actions. It might be that you withdraw yourself from the child. Kayla, the shouting is hurting my ears. I need a little bit of time to think. I'm going to go to the kitchen and make myself a cup of tea, and I'll come back and check on you in a few minutes. And while I'm there, I'll be thinking about how cross you are, how much you wish to turn this house into a fairy castle. So you could use a number of different techniques, take different actions, but all the while, acknowledging the child's feelings and their wish. So that's the strategy that I feel would be helpful for you to give to parents so that they can contain their children's difficult behaviors and their difficult feelings. The thing is, or the trick is here, is that parents, all of us, are wired to fix things. A child's got a cold, we fix it, we take them to the doctor. Their shoes break, we fix it, we fix the shoes, we buy them a new pair, whatever the case is. And with this model around emotions, our job is to change gears completely. We are not here to fix our children's difficulties. We are here to contain their difficult feelings, not to fix them. We are here to help them, to manage the difficult feelings, to hold their difficult feelings, and to see that they survive, you survive, and tomorrow's another day. So this is what Beyond calls a contained experience, where children will vomit out their difficult feelings and experiences, and our job is to hold and contain those difficult feelings and give it back to them as alpha elements, as digestible forms to manage their difficult feelings and their difficult experiences. Another way to look at it, the benefits of it, is acknowledging children's feelings is a bit like toilet training. Just like when a parent sees a child making a poo behind the couch, they'll say, "Oh, I can see, Sam, you're making a poo," and then maybe take them to the toilet. What they're doing is they're associating the word to the feeling. And then hopefully with exposure and practice, the child begins to say, "Mommy, I've got a poo." So it's the same with feelings. When we say, "I can see you so frustrated, it's so annoying when things don't work out," or when school, when the teacher doesn't give you those extra marks that you really feel like you deserved on the test. It's very annoying and upsetting. You worked hard for that test. I'm now using an adolescent example. What we're doing is we're associating, and we're actually giving our children EQ. We're teaching them how to label their difficult feelings. And that, the theory is, will hopefully prevent them from acting them out. I'd like to now present to you something about when things go wrong, more troubleshooting. And this is about when parents or children develop a hostile attachment. So usually I get the sense that the relationship has turned sour. There's a lot of hostility between parents and children. And this comes out when parents kind of think, "Oh, the kids." And it could be when the kids are 2, 12, or 22. It's unrelated to the developmental phase of the child. So what happens is that the child's needs or demands seem to be taking over the parent's space all the time, or often, not all the time, often. And that leaves the parent feeling like they don't have much to give to the other children. They don't have much time, energy, resources to have for themselves. They feel enslaved by this particular child. They feel like they're working for this child. An example of a 2-year-old would be parents put the child in, or a 4-year-old puts a child in bed. 3 minutes later, little feet down the passage, parents feel, but they try again, and then try again, and then try again. And eventually they are worn out and exhausted. So that's when you have a sense of parents' hostility, exhaustion, etc. But it could also be, another example is of a teenager where, and obviously the examples I use is fictitious, so that's for obvious reasons, but I'll use an example of David that I've made up from a conglomerate of clients that I see. And David is a teenager, and he just, he's going to be a billionaire before before he turns 30. And he's not going to drive an ordinary car like Dad. Dad's a loser, so why would he do that? And he just can't understand, what the point is about learning for history and dead people. I mean, honestly, what use is that? And he doesn't see the point of working for school either, even though his parents are paying a lot of money for extra lessons, because he doesn't need school. He's going to, excel, and he doesn't need school to reach his dreams. So what's the point? How do you feel about David when you hear me talk about him? Do you want to wring his neck? Because I do. So that's the kind of enslavement that some parents might present or feel when they see you and seek help. So it comes usually with a child who also feels tremendously entitled, like David, entitled to whatever his parents have got, even though they work hard for their money, entitled to waste his school education or not take responsibility for his school education. So it's when there is not a good balance, the relationship's not happening in the space in between, but rather that David is pushing the limits, and his parents might also give to David. They pay for his extra lessons, they bought him a new car, they take him to school every day, and eventually they also say, enough, I've had enough, David, enough, no more. You make your own choices, enough, I want nothing to do with you anymore. So that is just the opposite end of the same problem of giving too much or taking it all away. So we can see that in those situations, the relationship becomes quite a bullying relationship. And remember, it looks quite narcissistic as well, almost like a regress symbiotic relationship. So how do we deal with this? This I often call this is called, not by me, but it's called a hostile attachment, where the parents feel irritated by David, and the more irritated David makes them, the more demands David makes. The child knows whether David is 2, 12, or 22, that he's done something to disrupt the relationship. However, he can't get out of it because it's now become a pattern. So he makes demands, the parents get irritated, but they give in to the demands. That makes him feel more anxious, actually, or more demanding, and it disrupts the attachment more. And the more disrupted the attachment gets, the more hostility grows, the more irritated the parents get, and the more demanding David becomes. And this cycle of entitlement and enslavement goes on and on and on. And the best way, in my opinion, from work I've done to intervene is to work with the parents, not to work with the child. Children, it's not going to work when you say, okay, David, you're being ridiculous, stop it. It doesn't work, or I don't find. Of course, working with both is helpful, but always I start with the parents, and that is to begin to pull back the boundary and set the limits within reasonable limits. David, this is your pocket money. If you manage to be responsible by attending your extra lessons, by receiving or working for marks, just whatever, then you get to keep your pocket money. And your airtime, your data, etc., it's all in there. If you don't, then you get to lose your pocket money. You decide. So you acknowledge his feelings. Oh, we forgot about that. First, very important. David, I can see how frustrating and annoying it is to have to work and to be told what to do. You don't like it. You don't like when mom and dad tell you what to do. You're frustrated by school, frustrated by work. It just feels like all a waste of time. Reflect the wish. You wish you could just be your billionaire self that you want to be. I get it. But here's the deal. And then they set the limits. And they state expectations. And they set the boundary. And then they stick to them. Despite David's kicking and screaming and fighting against those boundaries. So that would be the start of challenging this hostile attachment. The next part that would be important as an important tip in this dynamic is for parents not to give a mixed message. In other words, not to say, because they get so exasperated by his behavior, of saying, oh, okay, fine, you know what, David, just do whatever you like. You know what, if you pass, you pass, you don't, it's your life. Not to do that, because they're saying one thing but they mean another, and that's not good for the relationship. So they need to scrap that and rather use the art of parenting. And I think the last point is for parents to be as consistent, as firm as possible. So to make the decision and then to consistently follow out what those limits are. So in conclusion, I'd like to bring up an important question. How do you know what to do when? When do you work with a child in play therapy? When do you work with a parent in parent counselling? When do you work with a family and the different parts of the family and maybe even bringing them together? So there are cases and clients where if you do not see the child, the parents won't engage in the therapeutic process. So I think we have to be clear about what's the goal of our behavior as therapists, and that is to be effective. If it means that you need to see the child 1 or 2 times in order to get the parents engaged in the process, but you feel that the effectiveness of your work will be more with the parents than with the child, then see the child for a play therapy assessment of 1 to 4 sessions, and then see the parents for 1 to 4 sessions, and you can dip into seeing the child sporadically in order to facilitate the work that you'll do with the parents. So you'll have to use your projective identification, your clinical skills and insights to say, where will I be most effective? Where will there be most progress? Then on the other hand, what I've noticed in working with children and parents is that the effectiveness of play therapy is effective in and of itself, which is really nice. And just building that relationship and experiencing the child in different ways and giving that feedback to parents is also very helpful. And I'll use an example that I had this week of a little boy who would change the rules and cheat to win a lot. And it drives the dad mad. And I was able to say in our parent counseling session that the way in which I deal with it in this play therapy context is I'll say to him, oh, you love winning. It's the best. It gives you the best. It's such a satisfying feeling. And I'm your Sheryl. I'm your feelings teacher. So I don't mind if you change the rules to win. But definitely you can't do that with your friends or with your parents because other people don't like it. And they won't tolerate it at all. And then you'll lose a few friends and they won't want to play with you and that won't be nice for you at all. So I almost give some of the strategies that I'm using in the therapy with the parents, and it builds trust. They feel like I'm helping them on a practical level through the therapy to deal with their parent questions in parent counseling. So that's where there's a nice mirroring of both, or of where one, you're using the strategies of one in the parent counseling of the other. And then of course, there's sometimes bringing a parent into the room, which sometimes is helpful. And I know that's a whole nother area of discussion of kind of filial therapy or family therapy. It's a different model completely. But I have at times brought parents into the last few minutes of our session, and really I would ask the child first, is it okay? Because I would not want them to feel betrayed, but should we share this and this and this with mom about how you're feeling about this and this and this in the therapy? And sometimes that's very helpful. Sometimes children need mommy or daddy to know that they're feeling these things, and then that takes the skills or the experiences outside the room and facilitates change in the family context, which is really what we want. We want to see growth, development, and change for the better and for all.